Hello. On this video, we want to look at the most important things to do to reduce the risk of having heart failure, probably instantly or in the future. If you look at heart failure, that's one of the leading cause of death all around the world, and we've gathered that heart failure is very popular in many parts of the world among men, among women. And apart from what people said, that people who have the habit of smoking cigarette, and apart from tobacco smokers, and people who think so much, who have people who are stressed, and people who have chronic heart failure disease through foods, salty foods, fatty foods, and all contribute to problem of or lack of exercises. And we also gathered that about 50 million people in the world and 13.4 million people, Americans presently have heart failure. 1.8 million Americans have serious coronary heart disease, and as we speak, lots and lots of people have this heart disease in Africa as well. So that's this reason. That's more reason like we need to educate ourselves on one of the most important things to do. Some people don't know what to do. They don't know, like we just go to the doctor, visit the doctor, and do this, do that. And some people don't know that they are probably living corpse, in the sense that it's only when they have issues, or when they have a strike or an attack, that's when they know that they have blood pressure. But there are important things that reduce you having the risk of having high blood pressure. And the first thing there is what to consult a doctor. For people who have heart-related disease, or people who just want to do this for preventive measure, you need to see your doctor regularly. The doctor can help you check your blood levels, your blood heart rate, and your cholesterol level, and also the blood pressure rate. So in case of any condition of movement or movement of circulation around your body, in and out of your body, your blood vessels, then the doctor is in best position to prescribe drugs for you or other medications. So if at a particular age, or from 40, 50 above, you need to see your doctor regularly, so that at least you know the condition of your heart. And you also need to check your blood pressure regularly. Either you have heart condition, you have high blood pressure, or doesn't. Because if you notice that high blood pressure is one of the starting problem that generates into heart failure or heart diseases. So you must get closer to your doctor, or buy the test, the sphygmanometer, or maybe like all these electronic blood checker, blood pressure checker. So you need to just do that. Then you have to go. You need to just go to the hospital to check your blood pressure regularly, or get this electronic manometer, which is available online and in drugstores. So some are electronics and some are manual, but all which you must check your blood pressure. Like, it tells you the current situation of your heart. It's not that they are doing too much. You don't even need your doctor to do that. You don't need to be serious about your health. Then avoid taking too much of salt when you are aging. You see, as you age, you need to reduce or prevent yourself from having high blood pressure through socks. And one of the most important things to do to stop or reduce your salt consumption is, salt contains sodium ion, which seems to be a metal ion and could raise the heart pressure when taken in excess or at a particular age. Your excessive intake of sodium ion into the body through the table salt can also make the heart beat faster. So more salt from age 50 above isn't that friendly to the heart, unless you are told to do so. But you must tell your doctor about this also. As you're avoiding the salt, avoid excess sugar as well. Like I said earlier, you can reduce the way you take all these things, which helps, especially sugar. You can prevent yourself from heart disease, because sugar is also one thing that is not really friendly to the heart, and you have to reduce it to the bare minimum. So taking too much of glucose may also lead to diabetes and obstruction of secretion of insulin. Then regular exercise. So one of the most important things is to also do exercises. And when you do exercises, it allows and it helps for circulation of blood around your body. So when you exercise the body, it helps you out. It makes sure that blood is well circulated around your body. And so those are some of the things you need to do. Yeah. So for the sugar as well, you have to reduce your intake of glucose, because too much of glucose can accumulate into glycogen, and which is also like the glycerol, a fatty component in the body. So all these things, when they're too much in the bloodstreams, can obstruct the flow of blood circulation in the body, and they also need to do that. Then avoid taking too much of fatty foods or junk food. You see, for heart problem, for high blood pressure, and for heart-related coronary disease and all those things, junk food are something that aid things, or they just make sure that these things, when you take them in calculation, you have high cholesterol and all those things. So junk food aren't part of something you're supposed to be taking. So reduce your intake of fatty foods, anything fried with animal fats at that age. You need to. So if you don't want to be reduce, you want to reduce your your exposure to having high heart-related disease, then you must avoid taking too much of fatty foods. Then after taking, you must eat more vitamins and fruits. You see, fruits, minerals, fruits, vegetables they have vitamins, they have minerals that helps in body development and the growth of dead cells and all those things. So you must make sure that you eat vitamins and minerals because fresh fruits and mineral vegetables because they contain vitamins and minerals that helps in the body. And so do all these things and also some cardio. You also need some kind of like plank exercise like jogging. You must do cardio at least 1 or 2 in a week. These cardio exercises, anything that makes your heart beat faster is what they call cardio exercises. So you can run, you can jog, you can do a lot of all these things helps the body in the sense that it keeps you healthy, then it keeps the body healthy and the heart healthy. That's what they call it cardiovascular exercises because it keeps the heart healthy. And when they keep the heart healthy, they make sure that blood are well circulated around the body from the heart down to the blood to the muscles to the veins and all these things. If you do cardio exercises, even stairs climbing is also an example. Plank exercise, when you climb the stairs more often, it helps you reduce your weight. And when you reduce your weight, it's also they are heart friendly exercises, really cardio. You can do that 1 or 2 in a week, every week. It keeps you healthy and it helps you reduce your rate at which you expose yourself to having a heart related disease and all these things. So and that's how. So we have talked about checking your blood pressure regularly. Most every time they see your doctor, consult your doctor, avoid fatty foods and avoid you need to avoid taking too much of salt, too much of sugar, too much of junk food and all these things. So these are some of the important things you need to do. Please don't forget to consult your doctor on all these and some other things. And don't forget that the most important thing, you need to get check your blood pressure regularly, because heart-related disease start from high blood pressure, and from there we can generate into something else. Then treat existing diseases, maybe like there are some life-threatening disease that you have. If you have diabetes, then you must treat it. Then don't joke with such. You see, if you have ailing ailments, if you have some ailments that are in the body, then you must make sure and try our best possible to monitor those ailments. Get your doctor involved, go to the hospital and be over and be fine. So don't forget to like this video, subscribe to us, and make sure you comment so that we can actually respond to those comments.